So welcome to this press conference to have an update on the situation of COVID. Mr. Legault is together with the Transport Minister and responsible for the Montreal-area, Ms. Chantal Rouleau, the National Director of Public Health, Dr. Horacio Arruda, the Mayor of Montreal, Ms. Valérie Plante, as well as the Montreal Public Health Regional Director, Dr. Mylène Drouin. Hello, everyone. First, I want to say that I am happy after 2 months to come back to Montreal. It was good to sleep at home last night. You probably know that I live in Montreal. I come from Montreal, from Sainte-Anne-de-Bellevue. That is the most beautiful city in Quebec. My mother is still there. Too much alone, but anyway, we could talk about that for a long time. I want to salute, first of all, the Minister for the Metropolis, Chantal Rouleau. I also wish to salute Dr. Arruda and Dr. Drouin, Mylène Drouin, from Public Health for Quebec and Montreal. And I kept her for the end, the Mayor of Montreal, Madame Valérie Plante, with whom I had a good conversation this morning. And we agreed on a few announcements that I'm going to be making later after the numbers of the day. But I want to take this opportunity, Valérie, to congratulate you and also congratulate all the employees of the City of Montreal. You have been involved. We knew at the beginning we were worried, for example, for the homeless, that you opened up shelters and day centers. The city employees involved themselves. So, bravo. Same thing with the food banks. We had said it. We didn't want anybody to not have enough food, but of course it required people in order to be able to organize everything. So the city employees participated in that. So from myself, thank you and bravo for everything that you have done. Thank you, Mr. Premier. I would like to start, therefore, with the day's numbers. We now have 131 deaths for a total of 3,351. And of course, behind those statistics are real people, real families and loved ones. So we have to think of them. We have 40,724 confirmed cases, an increase of 793. 1,834 people who are hospitalized right now, which is a decrease of 42. 190 people in ICU, a decrease of 4. A few comments before the announcements. First, concerning these tests, good news. We have sampled 13,291 tests. So we've taken this many samples. That means that we're gradually going to our objective. You remember, we wanted to go from 6,000 to 14,000, so we're continuing applying pressure. We should be able to get there with a bit more effort. And of course, most of those tests are conducted in Montreal. Concerning the staff, it's going up slowly for a fourth day. We have employees who are coming back to the health network after having been away on quarantine or some kind of absence for all sorts of reasons. So that is improving. Another good news, we had discussions in the past few hours with the Canadian Armed Forces who confirmed to us that they would prolong to the 12th of June the presence of the soldiers in CHSLDs. So we had some concerns that it would come to an end. So that is being now prolonged, and that's good news. However, when we look at the situation as a whole, it remains very fragile in Montreal. As you know, pretty much everywhere in the world, we all have the same conditions to deconfine, whether it be New York, whether it be the World Health Organization, whether it be in Europe. There are conditions to deconfine. The first is a lowering in the number of hospitalizations. As we saw earlier on, it's going down a little, which is encouraging on that end. The second condition is a lowering in the number of deaths. And now we have to look at it day by day, but we cannot see a significant lowering in the number of deaths. So we, of course, have to let the situation improve first. We also have to conduct more tests. So I'm happy to see that we're at over 13,000 samples. We should be able to get to our objective of 14,000, especially in Montreal, so that will respect the rules of this many tests per 100,000 inhabitants. And the last condition is perhaps the most difficult to fill. It is a number of available beds in hospitals, whether it be regular beds or intensive care beds. We have to remember, at the beginning of this pandemic, we had freed up 7,000 beds. Now we have gradually given back those beds because we're not even using 2,000 of them. So it would be possible to have access to extra beds. The problem is the staff. I come back to that. It's all very nice to say, we're opening tomorrow morning, and if we have a problem, we have 1,000 beds that are free, but we need more staff, and that is where there's a lot of effort yet to be made. So in conclusion, unfortunately, the conditions are not present in the Greater Montreal area to be able to deconfine. So I spoke about it with Valérie, and I am therefore announcing to you that schools, primary schools that were supposed to open on the 25th of June, we will postpone the opening. And since the end of the school year is about in mid-June, it's not worth postponing it really, so we are taking it to the end of August or beginning of September, the opening of the schools in the Greater Montreal area. We're still going to make some efforts. There are certain specialized schools, for example, children with disabilities, and we'll see whether it is possible to help out the parents. Concerning daycare centers, they were supposed to open on the 25th of May. What we're doing is that we are postponing the opening of daycare centers to the 1st of June. And we are going to follow the situation and see how things are by the 1st of June. Of course, daycare centers, it doesn't end in mid-June like the schools do. So if we can open them in June, we will do so if the conditions are met. Now, what remains is the businesses. And Valérie was telling me, and I've heard it as well, how much there's a lot of worry in certain entrepreneurs and certain business owners, particularly now that they see that in the rest of Quebec, businesses are open. They also see certain malls or big, not malls, but big box stores that don't just, sell food. So there's a competition that is unfair. So we are, maintaining the way that we're going, but the numbers have to keep going if we want to open on the 25th of May. What might help us is the use of masks. I'll talk about it later on. But if in Montreal there was a broader use of masks, including in grocery stores, it could help convince public health to open businesses on the 25th of May. I understand that certain people are a little bit discouraged in the business sector, but health has to come first. Speaking of masks, we talked about it a lot, Valérie and myself. This is quite the hot topic. We have agreed the government of Quebec is going to financially help the city of Montreal and the Greater Montreal area, and particularly the public transport. I think it was Ms. Drouin who was showing us pictures this morning of the metro. Unfortunately, there's still a lot of people who are not wearing masks, so we would wish that everybody would wear a mask. We will help financially, and we also have certain suppliers with whom we started working. Because as I said, in the past 2 months, we've worked on this possibility of being forced to give masks to the entire population. We started, of course, with masks for healthcare staff. And it's not simple. 1 million masks is one thing, 10 million is a lot more complicated. But we are able, I think, together, and I'm also, of course, asking for the help of the public, all those who can make them themselves or get them elsewhere. We are not yet at making mask wearing mandatory in public transportation, but we are not excluding it. Valérie and myself, we're not excluding it because it is important that Montrealers and the greater Montreal area wear masks in public transportation, particularly if we want to think about the possibility of opening up stores on the 25th of May. It's important that this practice become a habit. Valérie was also saying that it's important that we supply masks for those neighborhoods that are more affected, like Montreal-area, so those neighborhoods where there are people who are more vulnerable. So that too I've accepted, and we will be helping Montreal out financially. Later this afternoon, I'm going to meet the CEOs of the CUs and the CHU, so hospitals, all 16 CEOs of the Montreal area. Of course, what I'm going to want to talk about with them is why there were so many deaths, why there were so many infections, what guidelines were given, whether it be in the public or the private sector, because right now we are, I was looking at Ontario that is passing an act to be able to take control of certain private residences, a little bit like we did in the Aaron file. Of course, the capacity of acting is different in public and private for the CEOs in the CIS and the CUs. So I'll be able to talk about it with them of what it is that we have to do to help them out, what it is that we have to do with the staff as well. The people who were infected but who finished their quarantine, I want to make sure that those people are called and perhaps met, that it is explained to them that we have all the protective material, but that it's important that they come help those who have been there for 2 months and who need a break, who need some vacation. So that's what I will be talking about with CEOs, and I'll have the opportunity of talking about it with you tomorrow, since we're going to have another press conference here. And my daily thanks are for Montrealers. It's here that it was the hardest in Quebec, speaking of the pandemic, and it is here that we are going to be remaining confined the longest. So thank you for your patience. Thank you for your discipline. Of course, I'd like to take advantage of the fact to remind you that it is important to stay 2 meters away from other people when you go out, to wear a mask. And of course, I'm repeating my thanks from earlier to the mayor and the city employees. Thank you to all Montrealers who have contributed. I know that some people did it as well as volunteers to help us get through this pandemic. It's not over. There's still efforts to make, but I think that the best effort is to wear a mask and to respect the guidelines. So I also wish to take this opportunity to thank Dr. Drouin, who worked very hard and has been working very hard for the past 2 months and who is continuing to work very hard. So thank you so much, Dr. Drouin. So I'd like to end by telling you, the virus is not going to disappear tomorrow morning. It's there for months to come, unfortunately, perhaps even years. So we have to change our habits. I'd like to repeat 3 guidelines. When you leave your home, you wear a mask. You stay 2 meters away from other people. And when you come back, or when you're at your office, you wash your hands with soap. Quite simply. So once again, thank you to all Quebecers. I am convinced that we are able to take back control in Montreal and to come back to a life that is a little bit more normal.
Good afternoon. I'm very happy to be back in Montreal. I was looking forward to seeing the situation myself and to meeting our healthcare executives on the ground. We know that the situation is under control outside of Montreal, but it remains fragile here. We've concluded that the conditions are not met to reopen elementary schools in the Montreal regions. So today, we announced that schools won't reopen until August. As for the daycare centers, we're postponing the reopening to June 1st, but will only do so if all the conditions are met. We'll still give ourselves a few days to take a decision regarding the retail businesses. A crucial element that would help us to reopen is for the majority of people to start wearing a mask in public. I strongly recommend that we do so. I know it's been tough for people in the Montreal region. I want to address my daily thanks to Quebecers living in the Montreal region. Thank you for your discipline. Thank you for your patience. And I repeat our 3 rules for when we go out. 1, keep your distances. 2, wear a mask. And 3, wash your hands when you come back. So I'm counting on you all. Thank you.
Merci, Monsieur le Premier ministre. Madame.
Thank you, Mr. Premier. Madam Mayor of Montreal. Yes, thank you very much. I wish to first salute my colleagues at this table. First, the Premier of Quebec. Very happy that you are there, Mr. Premier. The Minister responsible for the metropolis and the metropolitan area, Ms. Rouleau, Dr. Ruda, of course, and Dr. Drouin. I wish to say that it warms my heart to be able to welcome you here today, and I am convinced that Montrealers share my enthusiasm. This morning we had an excellent work meeting, and it allowed us to really talk about the different issues, and one of the elements that I talked about with the Premier is the question of the possibility that certain problems intensify because of the pandemic, and I thank you for your opening to have targeted measures for those affected areas and for the people who are most affected, because yes, in Montreal what we're experiencing is more difficult, and I want to make sure that all actors work together. And since the beginning of the crisis, that is what we've been doing. We've been working really hard to bring together all of our efforts and construct our actions. And I can tell you that Montrealers they show a lot of solidarity, they show a lot of discipline and resilience. And of course, I invite all of us over the next few weeks and months to continue doing so, and we will be there to support you. And I was very happy to see that more and more amongst them are adopting the face covering or the mask. This is a very good thing. This is a complementary measure. We wish to remind you, added to washing your hands frequently and the 2-meter distance. But it is true that in Montreal, despite all the goodwill that people are showing, having 2 meters at all times is difficult and sometimes impossible. So I am very happy of the help of the government of Quebec and the Premier to be able to distribute face coverings for public transportation of all the different public transportation authorities, but also for the vulnerable communities and those more affected neighborhoods. And this help from the government of Quebec is going to allow us to have a massive distribution to the public. And as I was saying, we must make sure that that work is done in all of Montreal as a whole so that it's coherent. And of course, as of that moment, we'll be able to evaluate the pertinence of making wearing masks in public transportation mandatory or not. These are discussions that we will have with our different partners, and by partners I'm talking about public health of Montreal, but also those of the metropolitan area. So there's public health of the Laurentians, of the Lanaudière region, of Laval, and the Montérégie, on top of that of Montreal. So it is important to be able to all come together in that sense, and of course to work with community organizations, which are so helpful when it's a question of really understanding and documenting the needs of the public, once again, the most vulnerable people or those people who, for different reasons, don't get the messages as well. So we will continue working with our partners in order to be able to continue with face coverings. As far as the cancellation of the school year, I think that it was something that was becoming necessary to avoid the spread of the virus in the metropolitan area. However, it is clear for me that such a decision must come with measures. There has to be, we have to think about what we can do to help the children and the parents. For those children who won't be going back to school, but also the impact on the parents and social impacts, whether it be, dropping out or family violence or the stress and anxiety or the stress of the cancellation of the school year, we know that this decision can be experienced differently. It can be a shock for a lot of families, and we understand that. And we, of course, are going to think, all of us together once again, at offering options to those families. And I can tell you that at this level, we are well placed to think about this, since for the past 2 months we have already had very good collaboration and understanding of the issues in the field. And I'm also thinking that the work that was done by the City of Montreal over the past few weeks, and I really wish to thank the Premier for emphasizing the work of the City of Montreal and mentioning, because what we have wanted to do since the beginning is to support, to work in collaboration, to be partners that help out. So whether it be for people who are homeless, help out for the maintenance and coordination in low-income housing, or the shuttles, the STM buses, or the food banks. Let's not forget that, because this pandemic also caused a lot or made a lot of precarity more visible, whether it be monetary or in terms of food as well. So we're very proud to be able to help public health, the government of Quebec, as well as the health networks. I'd like to end by saying that we continue being there. And although this period is difficult, well, we are going to get through it together, and we are going to be able to do it as a whole. Thank you, Madam Mayor. We are going to start the question period. I'm going to say a few words in English.
So I'm going to be few words, like I always say. I definitely want to thank the Prime Minister for being with us today. It is, I'm sure that all Montrealers are behind me when it's time to say welcome. Welcome back in your city, actually. And so whatever it's regarding, well, just to say a few words about what the Prime Minister have just announced. Regarding the face covering, I'm very pleased that the Prime Minister and his government have accepted to support the City of Montreal in distributing masks, covering the cost of offering masks not only into the public transport or network, but also to different communities, the most vulnerable, but also where in areas and neighborhoods where right now it is more difficult. And to us, and this is what in the discussion we've had this morning, we can definitely consider making it mandatory. But before we do so, we want to make sure that those conditions are being filled. And now what we're going to do is talk with the other public transit network in the metropolitan community, to find out how do we do this in a coherent way, where also it brings a positive attitude, raising awareness. Those are the conditions we want to put together. So, and the other element that Mr. Prime Minister talked about, which is canceling the school year, I think it was the right thing to do at this point, because we know that the situation is still fragile in Montreal. We also know that the risk of contamination can be more important through students and through the school systems. So we will definitely, I agree with that decision. And we will be talking about how do we offer some options for families and for kids who might be in stress, dealing with stress or dealing with other issues related with the pandemic, of course, but also with the canceling of the school year. So at the end, I do want to say that since the beginning, we've been partners with the government of Quebec, the public health authorities, and the health network, and we will continue to do so. We will continue to support and be as agile as possible to support every Montrealers, because like I always say, we have to go through this together without leaving anyone behind. Thank you.
Merci. Donc, on va débuter la...
Thank you. We'll start the question period. There are microphones here. We would ask you please to limit yourself to one question per journalist.
Première question.
Bonjour.
Question is unfortunately inaudible. The interpreter apologizes. We cannot hear the question. Answer. Well, there are activities that had been set up already through Quebec, for example. We are going to ask teachers to communicate with the students and give them perhaps a little bit of homework. And when it opens up again at the end of August or beginning of September, there will be a certain period of time in order to catch up where there will be classes so that students can get to the following level. So Jean-François Roberge, the Minister for Education, is already working on that. It is the same situation for secondary schools. So there will be a little bit of work done at home before the end of June, and also work during when students go back to school. The interpreter does apologize. We don't seem to have sound for the question. Apologies from the interpreter who cannot hear the question being asked. Well, yesterday I think I was at 9,000 tests. Now we're at 13,000, so I'm happier than I was yesterday, that's for sure. Our objective is 14,000, so there is still work to be done, and I hope that I'm going to have good news on that front tomorrow. Concerning the CEOs of the CIUS, well, listen, a part of the responsibility is also the government's. You know, the different governments, one after the other. This crisis started with a lack of staff in CHSLDs, wages that were lower, that made it that we couldn't always attract people who should have had all the qualifications. We even proceeded with Je Contribue to hire people who had no qualifications. We have soldiers. So the situation is not ideal for the managers of the network, the health network. So we do have to take those things into account. Now, we have to ask ourselves questions. The preceding governments regrouped CHSLDs, CLSCs, the youth protection and hospitals in very large organizations. They cut certain managers who were responsible for each establishment. So the CEOs of the CIUS have to, be managers for a lot of establishments. So there's a number of managers that is more limited. Now, there's a coordination challenge in Montreal as well. The advantage of regrouping the establishments regionally is that there can be better coordination because there's one boss. However, in Montreal, there are the CHUs, the university hospital centers. For example, when we needed to transfer staff from hospitals towards the CHSLDs, well, it was easier perhaps for the CUs to be able to understand the urgency of doing that than for the CHUs. The CHUs don't have CHSLDs in their backyard. So it's all of that we're looking at together. And in the midterm, we're going to have to ask ourselves more questions on the governance and on how to make it all more efficient, how to ensure that the guidelines to limit infections are respected, because it's one thing to have the equipment, it's quite another to change the equipment every time that we change patient, etc. So it's all of that together that I'll be talking about with those managers. My objective is not to find guilty parties, just to find solutions.
Oui, j'espère. Puis,
Yes, I hope that they will be offering solutions, and I already know through Danielle McCann that they have some questions about all the residences that are private because their capacity to be able to make decisions is more limited when they are not public establishments. And I've already said, for example, that I wanted to very seriously look at the possibility that all CHSLDs become public. Well, that would reach that objective. Now, what will we do with our PAs and our Is and other residences? I'm looking forward to hearing those. If you'll allow me to talk about the screening program, yes. First, I wish to say that the number that the Premier offered is the day from before yesterday, because it has to be understood that the data from yesterday are going to come in during the afternoon. And I really expect that we have reached the 14,000 tests that we had fixed, and even perhaps go beyond it. And I would like to clarify, and my colleague, Dr. Drouin, will be able to do so as well. Right now, we have one of the provinces and one of the places where we're testing the most, despite all the comments being done. Testing, we are applying it, but we can't test 8 million people at the same time. So we are having a strategic approach, which is allowing us to treat cases and contacts and have the interventions and investigations. And now we're starting to do community screening. We talked about asymptomatic patients. The public health Montreal director said that some parents come with their asymptomatic children to have them tested close to the buses, and that is not the clientele that we're targeting right now. I can understand that it's not easy when you look at a press conference to have the specific details on that. It is truly the people who are asymptomatic but who are in contact with somebody who has symptoms. First of all, if you have symptoms, you come to get tested. Second, you live with somebody who has symptoms, you come and get tested. And that, I think it would be important to clarify. And it's also important that you listen to the guidelines of each of your public health authorities because, in Montreal, it's not the same thing, not the same modality that Montérégie, for example, or the Laurentians, or Lanaudière, or Laval. So I wanted to bring that clarification. I don't know whether my colleague, Dr. Drouin, would like to add something on that. Well, I think that it summarizes very well. Right now, what is important, especially in those mobile clinics, we have 6 that are fixed and 5 that are going throughout Montreal, and our objective was for populational screening. Our objective was 3,000, and we went over it today. We're at 3,491 yesterday, and we're adding mobile units, and it is possible that there will be more next week, additional ones. And clearly, it is truly symptomatic people and asymptomatic people who were in contact with a case or who are in contact with somebody who is ill. So people had guidelines from the schools to have, test everyone or their children. And the same thing, if people have guidelines from their employers to go get tested before going to work, those are not part of the guidelines. We really wish to target places where we know that there's community transmission, but to really target the correct people in order to be able to intervene and isolate those people as quickly as possible. But be ensured that we'll do everything in our power to increase the testing capacity in Quebec, even though it is beyond what it is elsewhere. We still have a plan to increasing it further, and we want to maintain that testing capacity, but to test the right people at the right time and in the right moment. Why not having closed Montreal right from the beginning in the first weeks when we had the first 500 cases, for example, Monsieur Legault? Well, listen, that was part of the scenarios that we studied right from the beginning. What we chose rather to do was to close the regions that were further to the north, where there were fewer cases. So, and obviously, I followed the guidelines emitted by public health. What has to be understood is that, in fact, the administrative regions, if you'll allow me to say so, are regions, whether they be health regions or sanitary regions, other kinds of divisions, they're not always the same. And what we look at very often is that it's what is a community and whether, the Montreal community is a whole. People from the South Shore, the North Shore come to Montreal, etc., to work, essential workers. So we make an epidemiologic epidemiological analysis of populational movements. Otherwise, we'd end up isolating streets. I don't know if you understand, but in terms of general dynamic, that's what was done in terms of orientation. Because we could have said, we're going to isolate sub-neighborhoods, but there's common transmission being done as well. There's movements that it would have been impossible to prevent between the North Shore and the South Shore. And we do realize that it's what's happening. So epidemiology, if you'll allow me, has to take into account populational movements, which are the natural movements. So it's in that sense that it was done. There are sometimes protections of certain subsectors. Let's take, for example, very far off places with very few healthcare assistants where we wouldn't have the time to transport a patient, where a local health system that would be completely overwhelmed. But the MMC, there are a lot of people from the north that come to the Sacré-Cœur Hospital. It's the same thing in the South Shore. So that's how we made the analyses. Talking about the MMC, Mr. Legault, you were talking about Sainte-Anne-de-Bellevue, and I was looking at the statistics. There's about 16 cases right now. On Monday, there was an interview to say that we feel far away from Montreal. Can we open our stores to save them before the 25th? And they're not the only ones asking that in the greater Montreal-area. What do you answer to those mayors whose economy depends on that right now? Well, listen, I have also received a lot of messages from mayors from the 450 area who wish to open up their stores. It has to be understood that the MMC is a whole. There are people from the North Shore who come and shop in Montreal, people from Montreal who go and shop in the North Shore. Same thing with the South Shore. You were talking about Sainte-Anne-de-Bellevue. I know that in Vaudreuil, Dorion, when I lived in Sainte-Anne, Vaudreuil was, the outskirts. But it's part of the MMC, and it is a whole. And what I would wish is to be able to open all businesses on the 25th, but with the condition that the guidelines are respected, with the condition that the World Health Organization conditions be under control, the number of beds, the number of patients, the number of people who are hospitalized, that it all be under control. So for me, it is true that Longueuil is closer to Montreal than Sainte-Anne-de-Bellevue is. I'm talking about downtown Montreal here. But we can't just look at the island. We have to look at the MMC. Mic is not on. Mic, please. If we do that, it's because we think that we have to go progressively. And now I would invite, and it's not the businesses, if we want things to go to lower, we cannot interpret that the summer is coming, we're going to open up a store, because the more people move around for non-essential reasons, the more we'll have contacts of transmission and contagion. And when we make investigations and that the public health teams contact you and you're a case and you're a contact, first of all, go get screened. But second, if you are told to stay home, you have to stay home. You can't hide things, because these multiple little nucleus, these clusters, these gatherings that bring about things can put in peril the entire reopening. So when we reopen the stores, we're going to try to do it with social distancing, etc. But I would invite the population to truly listen to what we say. It's not because we want to lock you up. It's because we want to reopen as quickly as possible and come back to a normal life and not lose what we've acquired up until now. I just wanted to repeat it. I'm sure that my colleague, Dr. Drouin, is in complete agreement. Listen to the public health teams. Listen to the guidelines. Only go out if it's essential. Do not go have a walk outside if it's not, in other regions, if it's not essential. These messages are for us to be able to get through this. I'm sorry that I'm repeating myself, but I will repeat it, and I'm going to repeat it. Do not forget to wash your hands, to wear the mask, etc., and do not gather in a clandestine way. Thank you. Hello, everyone. Mr. Premier, you touched upon the difficulties in hospital centers on the bed capacity. What is the maximum number of patients with COVID-19 or who could be taken care of in the Montreal hospital centers and Laval as well right now? And do you have any targets in terms of number of beds and a timeline? Well, look, when we have a look at the number of beds that we had freed up at the beginning of the pandemic, we had a lot more than what we needed. You know, right now in all of Quebec, we have less than 2,000 hospitalizations. So if I look at cities like New York, who said before reopening, we have to have a 30% buffer. Well, we could tomorrow morning free up 3,000 beds rather than 2,000. The problem is we don't have the staff. So the problem is not the number of beds, whether they be regular beds or intensive care beds. It is the staff in order to be able to face, if ever there was another wave of COVID-19 following a progressive deconfinement. Well, we have to be able to have that buffer. And right now, we don't have it because we don't have enough staff. Not because we don't have enough beds, because we don't have enough staff to have those beds function. But what is your target? You want to recruit how many people to be able to open how many beds? Well, what we want is to be able to get a few thousand employees. We know that there are many who are off right now. If we could get a few thousand of them, we could bring back to the hospitals the staff that we've transferred to CHSLDs. We'd be able to as well go back to regular surgeries, because it has to be understood as well that a lot of surgeries that were postponed, we're not at 100% right now of regular activities. So we also have to count on the fact that we will have to, at some point, go back to all surgeries, not just the emergency ones or semi-urgent ones. So we are missing a few thousand employees right now. A clarification on the masks. Mr. Premier, you said that maybe we'll have to live with this virus for a few years. I would like for you to clarify the help that you are going to be bringing to the City of Montreal. Are you going to be buying masks? How many? And are we going toward an obligation of wearing it? Would that be the first step? Is that the first step towards an obligation? The request that was made by Montreal in the outskirts is about $5 to $6 million to buy masks. We also have something that we've been working on in the past 2 months, companies that could supply a certain number of them. So we're going to help in two ways. We're going to fund Montreal and other cities of the MMC, and as well, we are going to be supplying a part of the masks. As far as knowing whether it will become a habit, I think so. I think that in public transportation, in all places where it is not possible to respect the 2-meter distance, I think it's going to become a habit for a certain amount of time to wear a mask. Hello, everyone. A question on the ventilation systems. I have colleagues that reported that there was a CHSLD of the Montreal-area, more specifically in Montreal City, where they would have had a contamination, a spread done through a ventilation system, allegedly. Although the investigation of public health is probably not finished on this, would it not be better to be prudent and proceed to the inspection of the ventilation systems in CHSLDs and perhaps even in schools, since everything is going to be starting over again? Well, listen, transmission through ventilation system has not, to my knowledge, but we'll check it. I mean, we are aware of the situation and the hypotheses that have been presented. I think that a transmission through a ventilation system is not what we call an important phenomenon in the question of the outbreaks, which does not mean that we should not, maintain them, have maintenance, for things like dust and other allergens. But I would say that right now I know that the teams are making an investigation. The Dr. Drouin's public health teams are making an investigation. We're looking at that. We're looking at the literature because there is apparently there would be a transmission through aerosol, but I don't think that it's a main factor, although there were a lot of employees perhaps that were ill and all that. But we also think that the question of hygiene and hand washing. I don't know if you saw that video that was shown where 4 people who are going to a buffet contaminated almost the entire environment just with their hands. So that is probably the most important factor. But we remain, like all scientists, quite open to any information. And if ever we see that it is a phenomenon, we'll see. I don't know if you want to say something, Dr. Drouin? Well, of course, with the infection control team of the serious investigation was done with environmental samples. But clearly, I would contextualize the outbreaks in CHSLDs. It's my time to have a hard time. But in a much more global perspective, these are environments where it is very difficult to set up exemplary practices for infection control, contrarily like a hospital. Because, these are places where people live. So hygiene and cleanliness with, people who have books and decorative items and television, well, of course, it's different. And ventilation systems, like Dr. Ruta said, have to be maintained systematically. But we've realized in certain places there was perhaps, air that didn't come from the outside, but more the inside that was recirculated. It's probably not the only element that would explain why the health workers in a certain proportion contract the virus in CHSLDs. Of course, there's a lot of staff turnover, so clearly the ability of that staff to be able to apply the correct measures, well, for us, it's a multifactorial element, and the control of infections in those residences specifically. And the ventilation is one of the elements that is being studied, but clearly in the literature right now, it is probably not the only element that would explain our difficulty to get out of this. But if I understand the explanation, Doctor, but considering that the majority of cases are in CHSLDs, I asked all CEOs at the beginning of even last weekend to have a look at to making sure that the maintenance of their ventilation system be updated. But these are practices that are supposed to be done at all times. But clearly that was done. But it is part of a series of measures that are being set up in all CHSLDs right now. Following question. Concerning the lack of employees to add beds, you were talking about a few thousand. We contacted all the CEOs in Montreal, and most of them told us that there's still at least 2,300 employees who right now are in work stoppage because they have the coronavirus. And there's the people from Je Contribue and the Army, but what is the next setup for these thousands that you need? Are we going to ask regionally, and is it a good idea to recruit people regionally when we want to limit movements? When we're talking about recruiting people who will come and work full-time for a certain number of weeks in Montreal. And we announced last week important bonuses for the people who also work part-time, because there's half of those employees who are working part-time. So what we wish is that there be more full-time workers amongst the part-time workers, that they become full-time workers. And secondly, we also wish that those employees that are still absent, those who have finished their quarantine, well, we would like for them to come back to work. Concerning businesses, there's more and more pressure to allow for at-the-door pickup. Why is that not already being picked up or being done? What is something that we are considering? I even talked about it with Doug Ford, the Premier of Ontario. They have set it up, and they are getting ready to open businesses. It's not always simple, to shop without going into a store. It's not ideal for all businesses, but it is something that we are studying. But honestly, I continue thinking that we cannot exclude reopening on the 25th completely, but it could be an alternative. If ever the conditions did not allow reopening, could we at least allow businesses to give their products at the door, one by one, to the clients? It is a possibility. You are close to the target for a screening test. Do you have what is required to do the epidemiological tests? it has to be done quickly from what I've understood. In Montreal, can we have a fair portrait of the situation? Are all the investigations, can they all be done to avoid the spread? I'm going to let Dr. Drouin answer. Up until now, we have been able to do it, and we know that we have to increase the capacity importantly. There's work being done right now to go get full-time resources to increase, but I think Dr. Drouin can talk about Montreal, which is one of the places with Laval where the most investigations are being done. Well, over the past few weeks, we have like our army, as I'd like to call it, close to 430 people who have been recruited in different through different means, like Je Contribue and different spheres of society, to join our team. But as we've said it, these are often people who can give a few hours or a few days per week, so we have to stabilize that team. We were able to conduct the investigations in the 24 to 48 hours. Our target is really to do it within a 24-hour period, knowing that we, start the populational screening again, and we expect to have more cases. So we are recruiting new investigative teams, but particularly we're looking to work with a firm that is going to help us do a part of the more administrative aspect of the investigation, so that the clinical part that requires specific expertise be really concentrated, and that we perhaps will need fewer people with specific expertise. And of course, it's the entire, computerization that will help us out. So we really are building it all together and working at mobilizing what we call our prevention brigades. We had put them in the RIs and the intermediate resources who don't have cases right now, to make sure that the virus will not go in. So we know that there are teams that are working on, putting out the fires, but we thought that we also have to work on those that don't have a fire right now. So we're going to have these squads, these prevention squads for all environments. So not the school ones right away, of course, but the daycare centers and all community areas. We already have them for all that's, shelters, homeless shelters, of course, community areas, low-income housing. And we're also building a frontline army that is going to go prepare those places and manage if there are cases, because there will be cases in those areas. So we have to manage it correctly and have people right there. So that's all being done right now. Some are already functional, but others will require us to recruit more resources. To what extent is the portrait that we have in Montreal right now, is it specific? Is it the number of resources? No, the number of infected people. Is it last week's? No, yesterday we filed user numbers. But those numbers is what's going on right now? Yes. We have daily numbers of all the cases and contacts that we are following. And of course, we also have our own indicators of processes that bring us to say sometimes that we have backlogs in our investigations, and that bring us to add teams of investigators. So that is a lot of work. It's the Army of Public Health that we perhaps don't see as much as the frontline armies, that is in intensive care or in CHSLDs, but that is working super hard since the beginning of this all. If you allow me, with the data, the numbers come in every day and the samples as well. The issue is the deaths. You saw that sometimes we announce this number of deaths, but in fact we realize that there are cases that go back to 2 months for all sorts of reasons that have to do with logistics. Now it's improving. So I just want to explain that once again. The curve of deaths really is going down. Even if we announce, for example, today, or one day 89, it's not 89 deaths in the past 24 hours. It's 89 deaths that are perhaps, over the past month, because we need processes of validation and investigation that are made. And if you'll allow me, because often we're asked if we have the data. Yesterday in Quebec, the question was asked. We looked at the death excess compared to the data of March and April of last year compared to this year, and what we have as a number of deaths is about similar to what we have in our death access system, which is not the case in a lot of countries where now they have 3 or 4 more excess deaths than what they had put. So our system is very sensitive. I think there's an important phenomenon in Quebec. I don't want to deny it. But there's also a phenomenon where we try to capture all the data for the death toll in our healthcare, which is not necessarily done in all jurisdictions. It doesn't mean that we don't have a problem. Any death is one too many. That's clear. But I did want to put it in a context because often people hear 89 and they have the impression that 89 people died today, where it can be, over the past 2 months. Mr. Legault, you mentioned right off the bat that you come from Montreal. Why did you wait 2 months after the beginning of the confinement before coming here and not having had the discussions that you're going to have with the CIUS, for example, right at the beginning? Well, first, I have had discussions with the assistant ministers and minister on a daily basis, first. And second, I think it's important that the Premier give the example where, if we ask people to not go from one region to the other, well, it's a very good idea to do it ourselves. And I mean, my 2 boys are in Montreal. It's not like I enjoyed not doing it. I wanted to see them, but we told people don't go from one region to another. So I wanted to give the good example. But I think that now the situation is evolving and it is important to come. As far as the school is concerned, Mr. Roberge mentioned that there might be remote learning in the fall. That is one of the scenarios being considered. Do you think that it's a good idea as far as, school dropout rates? We're saying that it could increase by 5 to 10%. Well, no, I'm going to do everything so that schools, CEGEPs, and universities, whether it be done, that it be done in person, because first, it's a lot more motivating, and second, there's a life, young people have to live and meet other people, so that's an important part of life and of being a teenager. So I'm going to do everything so that it can be done in person, but of course, we're going to have to respect certain standards, certain norms, and make sure that, the 2-meter distance is there, for example, and see who has to wear masks, etc. But I wish for it to be done in person. But we cannot right now exclude being forced to do a part. For example, take the example of universities. There's amphitheaters where there's a lot of people crammed together. Can we give a certain number of classes in person and others online? Things of that nature. But my first choice, and I was a Minister of the Education for 3 years, and it is very important to fight against dropping out, that there be, the physical motivation of being there in person. I'd like to talk to you about the gloves. We talked a lot about masks, but do we have enough gloves? We have no problems with the gloves. We have at least for the 24 days coming, and we continue getting them regularly, so there is no projected problem with the gloves. Also, are we going to a new health reform just a few years after the Barrette reform? Could it change once again the way that the CIUS, CIS, and CHUs are managed? Well, I'm not a fan of shaking things up too much at a structural level. But what can we do so that the situation that we experience in CHSLDs does not happen again? We knew there was a problem. I often talk about it. In the electoral campaign, we promised to increase the budgets of CHSLD significantly, which we did. However, where we hit a snag is that the positions remain unfilled because of the wages. And the wages was planned to be bargained during the collective agreement negotiations that were supposed to start in April 2020 to have an important increase of the wages of orderlies. And it's not simple. All governments that have governed have never managed to have differentiated wage salaries, that is, to not give all, the same wage increases to the 500,000 employees of the state, for example. We want to do it. We want to do it for teachers as well. I think that we have an adjustment to bring. However, if I could say, is there a good aspect to the crisis? Well, one of the great objectives and challenges, and all of the reports mention it, clear reports that were made in health, they say that the key is the first line. We have to have better use of general practitioners and family doctors. There has to be part of those acts that are delegated to nurses. But during the crisis, for all sorts of reasons, perhaps bad, good reasons, a lot of patients were scared to go to the hospital. So they started accepting calling their family doctor. So we changed the payment of family doctors so that they be paid when they have that telephone consultation. So I think that we had to plan on that, to bring the reform that should have been changed a long time ago. So to have a first line so that people who have lesser important problems, the P4s and P5s that they're known, are treated by their family doctor or nurse. Because before the crisis, let's remember that 50% of patients in our hospitals, in our emergency rooms, were people who had minor problems, who should have been treated in first line. So the most important change to bring in the health network, and which was never made, Dr. Barrette gave 2 years to the FMOQ to take charge of it, to conclude that it was not done. And we are still at the starting point. Not simple to bargain with the FMOQ. I agree, but maybe this is a good opportunity. English question period.
Global. I also wanted to ask you about that VG situation in which they had so many employees and so many residents getting sick so quickly that, and then those concerns about the air filtration system, and the FIC even was so concerned that they went to court and tried to get an injunction to force VG to take action on this. And I'm just wondering what you think of this situation in general.
Well, I will begin, and I think I will let Dr. Drouin, who is in Montreal and aware of more things. First of all, I think the taking care of our filtration air is something which is good for all kinds of diseases, especially allergies and everything. But it's not probably, I would say, the only factor, or even it's perhaps a very low factor in the transmission. It has not been reported in the scientific thing. I think there is probably other factors related to the difficulty to apply, I would say, PCI, which is prevention and control of infections, and those settings, which are not like an hospital, they are like a home. There's a lot of objects to clean. There was probably less people working, so they had pressure. They probably have not applied the things. They could have dinner all together, and there's all those kinds of factors. There is actually an inquiry done by the public health. They took some environmental things. Most of the time, it's on touching what we call high touch levels where we can get the disease. So I will let Dr. Drouin say that.
But I don't have many things to add. But public health is not really involved in the injunction because it's associated with the CIUS Centre-Ouest. So it's more. I think the questions must be asked to CIUS Centre-Ouest. But as Dr. Arruda said. We have to, and all the outbreaks that we're seeing in CHSLD, they are complex to control because the PCI, applying the gold standards for PCIs in those establishments is quite complex. And ventilation may be one factor, but we do not think in the literature is not. At the same time, we're learning about this virus. We're learning every day, but we think that maybe it's multifactorial aspects that are involved in the difficulty to control the outbreak and the explanation why so many healthcare workers are getting contaminated.
Premier, Giuseppe Vagliante, the Canadian Press. You've come to the city that you're from, the city that you live in, to announce 131 new deaths. I'm sure it's difficult for you, being from Montreal. You've taken responsibility for maybe not paying more, the orderlies, the préposés. You've talked about successive governments not investing more in the healthcare network and in long-term care homes. But yourself, as a Montrealer coming to your city, do you feel like you failed Montreal?
but I think the society failed. We know that in Quebec we have 3 times more people in the CHSLD than anywhere else in the world. So we decided as a society that our elderly will go to those centers first. Second, many governments, Liberal government, PQ government, CAC government, decided not to invest enough in those centers. And we decided a year and a half ago to invest more, but unfortunately, we weren't able to fill the posted jobs because of the level of salary. And it's not easy. I can understand that from the outside you say, hey, why don't you increase the salary only of the PAB? We have right now an offer on the table to raise this salary by 12%. And some unions, they answer that they would agree if we increase everybody by 12%. So it's not easy. I know that Dr. Barrett tried to change that in 2015. He wasn't successful, but I think and I hope we had a lesson. And in the future, I can assure you that even if I have to impose it, I will increase those salaries. I will then have more people in those centers, will refurbish and build what we'll call Maison des Aînés instead of CHSLD, which will have more space for each people, places where we'll be able to separate better hot zones and cold zones. It was not easy to do so right now. So I think that many people are responsible. I don't exclude myself. I said it, yes, my government increased a lot the budgets, but we didn't increase the salaries of the préposés fast enough.
Good afternoon, Alicia Rubertucci from City News Montreal. Premier Legault, you spoke a lot about mental health and the importance of children being back in the classroom. I just want to know what changed and what will be done for students now that postponing to September will mean 6 months out of school.
Yeah, it's clear it's not for the children. It's not my first choice. That's clear, because it's not good, especially for children having learning difficulties. It's not good for sure. But right now, the situation is such that we cannot take this chance, because children, even if they don't have a high percentage of probability of dying, it's very low. In fact, we have nobody under 30 years old who died so far. They can transmit the infections, and they can transmit it to their parents or grandparents, and it's too dangerous. So I'm not happy to tell you that unfortunately those kids, they won't be able to go to school. So we've put some video on TV. We'll continue to do so. We'll ask teachers to get in contact at home with the children, give them some work to do. We'll do our best, but I know it would have been better to reopen the schools.
Prochaine question.
René Brumer, Montreal Gazette. Bonjour, Monsieur Legault. Teachers and parents have been complaining that given that elementary school students have been out of school for 2 months, that the materials, educational materials supplied to them, or online courses supplied to them, have been lacking, that they've not been adequate, a lot of sort of videos, but not enough structure for the children or for the parents to give them, much to their frustration, especially compared to other jurisdictions like Saskatchewan and Alberta. Firstly, why is this? And secondly, given that they will not be returning to school until August or September, how are we going to try to improve that?
Yeah. Well, first, it's your judgment saying that our material is not as good as somewhere else in the world. That's not what we think. We think that the material that was given was good material on TV and online, on websites, and we'll continue to improve what we're giving to our children. So for me, it's important that we give them ways to make sure that they continue to make efforts to learn, and we'll try to do more, but we did a lot so far, and I disagree with you to say that it's not as good as somewhere else.
Prochaine question.
Anthony Nerestan from CBC. I want to go back to something that was asked yesterday regarding masks. I know it was said that the most important thing to deal with this virus was hand washing, but now hearing you recommend so strongly that people should wear masks, when Canada's top doctor said that it was recommended back in early April, we're in mid-May. How much, when you look back, would you say that we wasted time not strongly recommending that Montrealers wear masks? And how much do you think that delay put the city in the predicament that it's in right now?
Okay. First, it's important to talk about masks when you reopen or when you're thinking about reopening. When you're at home, you don't need to have a mask at home. But if you open the businesses, if you open schools, I think then it's important. I think that the key is really also the collective transportation. Because when you're at more than 2 meters, you won't get the virus. But so far, and we were fortunate in a way, in the last 2 months, there were not many people in the collective transportation. But if we open, for example, businesses on May the 25th, we'll get more people, and it'll become more difficult to keep the 2 meters. So it becomes more important to wear the mask. Also, I think it was important to change the habits one by one. The most important habits were washing your hands very often, and stay at 2 meters from one another. I think that we were successful. I'm looking at the people, and they respect that, many of that. Now we are thinking about reopening. We have to add the mask. We still don't think that we have to put it mandatory, because we don't want to tell people that cannot get a mask that they cannot use, for example, the collective transportation. So we will work together, Valérie and myself, to find masks, to give those masks to all the people, because those masks weren't available in the last 2 months. We were first putting in priority the healthcare needs for masks.
We'll take the next question. We don't have time. I'm sorry. We'll take the next question.
We've heard of cases of children showing Kawasaki-like symptoms. Was that part of your concern here in reopening schools?
I would say that the phenomena of Kawasaki, and I would say that Bluetooth toes, is a preoccupation. As we are learning more and more under the virus, we're going to see things. The Kawasaki problem is a problem which is rare. There is others infections that are associated with Kawasaki, but this seems to have some association with COVID-19. But that was not, I would say, the principal criteria, because it would mean that if it was the principal criteria, even if it's rare and even if it's going to happen, probably, it would mean that if we only go on this, we will never open schools anymore, so which is not the case. But I think we are making studies. Saint-Justine is making studies about this and other places in the world, and we will take that into account. Most of people who had the disease recover. They were actually, but we are following that specific issue. But that was not part of the decision of reporting, I would say.
What was the principal reason?
I think that the Prime Minister explained then. It's all based on the 6 criteria of the WHO, where is that we haven't seen enough going down of the hospitalization and of, I would say, the people dying. We are going down, but not at a level that is we are happy. We have been doing tests. This could be okay in the next 2 weeks, but at the same time, there is the issue of the capacity of the system, because we had a big capacity at the beginning of the epidemic. We had 7,000 beds around, but we now have more cases. We still have capacity. We still have no problem with intensive care units or like this. But if there was a big, I would say, coming back of the disease in the Montreal region, you could be stressed. I know that my colleague, Dr. Paterny, would probably find places. We also have begun some operations, because you cannot postpone normal operations for a long time. This is one of the criteria, and I think that's almost what the Prime Minister said, and we will do that on each time we're going to evaluate. And I was asking also the people to please keep in touch with us, make our recommendations, because even you, in your own homes or in your own habits, if you don't protect yourself, or and especially if you don't collaborate with public health when there is cases and contacts to stay isolated, you could be a source of a drama that will make us going back.
Merci beaucoup. Thank you.
Merci.
Thank you very much. Thank you, everyone.
Tu lèves ta place.